State of the Vallejo Municipal Code related to the prohibition of smoking.
And I will recuse myself on the continuing basis of having an economic interest in the subject matter. Vice Mayor, please take the chair.
I will also recuse myself. Thank you.
Okay, hold on. Let me get my... Okay, will you please announce the item? Dawn? Oh, you did already. Okay, sorry. Okay, is there any follow-up staff presentation? I know that you did a presentation from last month.
We did do the presentation previously. As council is aware, just very, very briefly, this ordinance is designed to address the prohibition of smoking in multifamily housing as well as in common areas where businesses share walls, if you will. It does allow for the designation of smoking areas by either the outdoor smoking areas by either the commercial operator and or the residential operator. If council has any questions with regard to the specific provisions of the ordinance, we'll be happy to address those. And I know you received a fair amount of public comment, so if the council would like us to address and or respond to public comment, we'll be happy to do that.
What we'll do is we'll start the clock, the 2-minute clock, and then while we're waiting for that, I'm going to call on speakers that are here, that are present, and Councilmember Meisner will call the names.
Okay, so we'll start with the first three are Kimberly Nunez Bandero. I'm sorry, I can't read the writing. Okay. The next is Joseph Hayden, and the next is Brian Davis. So those three first, if you could get ready to speak. So, Kimberly?
So I'm not for tobacco smoking. Of course, there needs to be a ban for indoor smoking of nicotine in multi-unit housing. Keep in mind that nicotine is extremely addictive and it takes time for cessation. 90 days is not enough time to give notice. There needs to be free resources provided and incentives to help people stop. Cannabis advocates and patients are asking council to add an exemption for cannabis, especially medicinal cannabis, to this ordinance. You cannot legally smoke cannabis outside. You've included in the ordinance private smoking lounges as a place to utilize without being specific as to whether it's a tobacco or cannabis lounge. No cannabis lounges exist in Vallejo. Even if there were, do you expect a medicinal user to run to the lounge every time a symptom arises in which they need relief? What if our ill or disabled community members cannot access transportation? Are we going to punish them? Where can the medicinal patient safely use their medicine? Their car, if they even have one, that's against the law too. Edibles aren't for everyone. Edibles do not produce the same effect as cannabis flower. It can produce a very unpleasant and intense feeling for some. It's hard to gauge the dose. It can take up to an hour to feel effects. They're very full of sugar and can negatively affect those with health issues. Tinctures are very expensive too. Now, cannabis inhalers, I haven't seen this product in any of the dispensaries around here, and they are too expensive if you can even find them. Would you rather people resort to opiate painkillers and other drugs like heroin and fentanyl to relieve their pain for fear of eviction? I would certainly hope not. Now, what about the smoking of illicit drugs like meth, crack, crushed up pills, opiate painkillers, stimulants, barbiturates? They also produce smoke. Is that okay? Also, religious and sacred incense, herbs, plants like sage, palo santo, sweetgrass, mugwort, cedar, sandalwood, even tobacco are burned during the sacred practices and produce smoke. Are we going to violate people's religious and spiritual freedoms? Landlords and neighbors could say they're smoking when they're not. It would cause a lot of litigation, and it would include the city manager, and anybody else who wants to enforce it. We need exemptions. This ordinance, as it's written, will empower landlords and private citizens to retaliate against their tenants and neighbors. It can cause homelessness. Also, I had a quick question. Please explain to me Section 1G, Bullet 5. It really should be removed. What does sexual orientation have to do at all with smoking? No matter how woke one might think they are, there is so much to learn and realize. If one has never had to go through these struggles, or even if you have risen above them, you have privilege. It gives you an advantage. Let's work together by adjusting the wording to the ordinance and by providing exemptions to ensure that we don't marginalize our most vulnerable citizens. Thank you.
Thank you. Next is Joseph Hayden, followed by Brian Davis.
Hello. Good evening, City Council. Just as I mentioned last time I spoke about this, this is not just a social health issue, it's also a social justice issue. I have here a picture of an inhaler that's available for California residents. It costs $27. So that is a viable option. In addition to that, besides edibles, which people can change their recipes if they want a different dosage, there are also infusion drinks and other ways without using combustibles or aerosols to get cannabis. So Benicia, our next door neighbor, has a very similar ordinance to ours with no exemptions. So I would say that our youth, some of whom are here and will be speaking as they did last month, compellingly, I might add, deserve the same rights when they live in multi-unit housing here in Vallejo. So, I also want to state for the record that I love the fact that I live in a state that has legal cannabis. I was a huge proponent for the decriminalization of it. So the fact that some people are still trying to say that this is an anti-cannabis bill just doesn't land well for me. So secondhand smoke of all kinds can drift throughout a multi-unit housing building through doors, windows, hallways, baseboards, ventilation systems, light fixtures, etc. Smoke is smoke. Both tobacco and marijuana smoke impair blood vessel function similarly, and people should avoid both. And governments who are protecting people against secondhand smoke exposure should include marijuana in those rules. Secondhand marijuana smoke contains many of the same cancer-causing substances and toxic chemicals as secondhand tobacco smoke. Secondhand smoke from combusted marijuana contains fine particulate matter that can be breathed deeply into the lungs, which can cause lung irritation, asthma attacks, and makes respiratory infections more likely. Exposure to fine particulate matter can exacerbate health problems, especially for people with respiratory conditions like asthma, bronchitis, or COPD. So in the interest of public health, the use of combustible or aerosolized marijuana should be prohibited wherever tobacco smoke is prohibited. Thank you.
Thank you. Next speaker is Brian Davis, followed by Kaylin Kelly and Jimmy Ancisa.
Good evening, council members. My name is Brian Davis, and I run a project called LGBTQ- Tobacco. And I should mention, in response to the previous speaker, that the LGBTQ identity matters because queer folks smoke, use tobacco products significantly more than other folks, than the general population because of homophobia, transphobia, and the stress caused by that, so it is relevant. I'm also a member of the Tobacco Free Solano Coalition. You've heard my story before over Zoom, but I wanted to be here in person so you know how much this matters to me. I do have lung disease, which over the last year has reduced in severity enough that I am braving COVID to be here tonight. To recap my story, a number of years ago, a cigarette chain-smoking tenant moved into the apartment below me. He refused to go outside to smoke and caused my life to be a living hell for a year until he thankfully moved away. After he moved, our landlord voluntarily made the building smoke-free, and I thought my problems were over, but a year before COVID, a cannabis smoker moved into the apartment that shares my bedroom wall. The bedroom reeked and breathing was often difficult. I asked her to smoke outside. She said she would be arrested if she did and that she had a medical cannabis card and needed it for her health. I also smelled the cloyingly sweet odor of vape usage while she lived next door. Thankfully, she moved away during COVID lockdown. I emailed you earlier today with some links to back up my statements that yes, cannabis smoke is toxic, and there are many available options for THC medicines that don't require smoking or vaping, including drinks, tinctures, gummies, topical ointments, etc. I know that some, such as previous speaker, will say that those options won't give them the immediate pain relief they need. For those people, there are cannabis inhalers that go directly to the lungs and take effect quickly, don't put out smoke or chemical vape. So their use not only protects the health of neighbors, but also healthier for the user. And as previous speaker said, $27. I saw that online today, $27 at a cannabis retailer in Oakland. And these are harder to find, cannabis inhalers are, but they can be ordered wholesale by Vallejo cannabis dispensaries via a link I shared with you and are available in local cities or online, as I said. With alternatives available that provide relief for medical cannabis users and recreational users, there is no reason to allow residents of multi-unit housing to be exposed to toxic smoke in their homes. Thank you.
Thank you. Next speaker is Kaylin Kelly, followed by Jimmy and Sarah. And the next is David Haldane, those three.
Good afternoon, council members. You know, it seems like you all are going to have to choose a side. And the side that you choose may not make you popular, but it will make you courageous if it's the correct choice. Some of you council members are mothers. Would you tell me that it's okay for someone in your multi-housing unit to be smoking medicinal, recreational, marijuana, or anything else while you're in any portion of your term? I'm just going to leave that question out there for you to think about it for a moment. It's not even for a response. I'm up here to say that nobody is trying to take cannabis away. We are just saying that there have to be viable alternatives so that everyone has access to the same human right of fresh air. That is not so much of an ask that it takes months and weeks and years of contemplation. There are cities like Benicia who have already demonstrated the courage to do this. What you have to do is find it in yourself to understand that the impact is disproportionately hurting people that look like me, that look like you, that look like your children and people in your community. I understand that people want to medicate. In 2003, I was robbed and shot in San Francisco, and I experienced partial paralysis in the upper right torso area. I received a medical prescription to use marijuana. I did receive a notice from a landlord saying, hey, this is not something that we allow here. You're smoking indoors. At first, I didn't even care. At first, it didn't matter because I needed to medicate because the pain that I was going through was so intense. I don't know if you know about your body trying to fight off paralysis, but it's extremely painful. And so once I got my prescription, I was like, hey, this is my gold key. This is my panacea, if you will. I'm going to smoke this in my house, in my friend's house, and that's what I did. Until I went to my therapist and I was giving her a rundown of how everything was going with my therapy, and I said, oh, and there is this one thing. This landlord keeps accusing me of making people impacted by my secondhand smoke, but I don't think you want to know about that. And he said, actually, your therapist is right. But it was my personal choice, the same way it's a choice for all of you. It's a choice. And it didn't make me popular amongst my friends when I wanted to go outside and smoke. But I felt the courage to do what was correct. And that's the same courage that I'm hoping that all of you will find tonight.
Thank you. Next speaker is Jimmy and Sarah, followed by David Haldane.
Good evening, City Council. My name is Jimmy Ansera, and I am a member of the Tobacco Free Solano Coalition, and I am a part of a project called LGBTQ- Tobacco. 3 years ago, I broke my femur in an accident and was prescribed oral pain medication, which made me extremely nauseous. A friend suggested smoking cannabis to alleviate the pain. At that time, I lived in a smoke-free apartment complex that was on the 3rd floor with no elevator. Getting down 3 flights of stairs with a broken femur to smoke cannabis would have caused more pain than it was worth. I refused to smoke indoors because I did not want to expose my neighbors or my partner to the harms of secondhand cannabis smoke. After doing some research, I discovered numerous ways to consume cannabis without smoking it. The various consumption alternatives I found range from cannabis tinctures, drinks, edibles, transdermal patches, and topical products. From the options available, I found an alternative that provided me with relief. I respect the role that cannabis plays in pain management, but I also recognize the need to protect everyone's ability to breathe safe, healthy, and smoke-free air. There is no reason to allow residents of multi-unit housing to be exposed to the toxic cannabis smoke in their homes. Just because cannabis is legal to use does not mean that it should be used in any way to harm other people. Thank you.
Thank you. Next speaker is David Haldane, followed by Dicante Moses. I'm sorry if I'm pronouncing your names wrong. And then Kristen Vinlium. Thank you.
Thank you, Council. I encourage you in general to pass this bill expeditiously. Preventing the exposure of our citizens to tobacco smoke is critical. Item G has been the subject of some discussion. It seems odd that we need to call this out. I'd like to sort of flip it on its head a little bit, remembering that I support this bill. But these are the people who you will be affecting, who you are asking to quit smoking or you're homeless within 90 days of you saying yes. African Americans, Asians, Hispanics, American Indians. Low socioeconomic status American Indians and Alaska Natives. High school age African American youth. Californians with low educational attainment. Bisexuals. Renters, we have a few in town. And those who have experienced psychological distress. These are the people that you're saying within 90 days, quit smoking indoors, quit smoking in your house, or you're out. A just proposal, but it is a heavy one, and you're asking people to change their behavior. In lieu of that, not in lieu of that, in tandem with that, I would encourage you to include funding for smoking cessation and include cessation options and fix-it tickets, if you will, as in the, possible options instead of skipping straight to fines and material breaches of leases. So I'd recommend removing at least the bisexual item, or if not, including an item about my trans friends, because I know that most of my trans friends smoke. So if you're going to mention bisexuals, please be inclusive. Item Y, it has an exception for the sacred and religious use of tobacco. I would encourage you to add a medical exception to that as well. There are medical conditions that smoked cannabis is better for, most of them bowel conditions, most of them acute onset conditions that people struggle with for their whole lives. There are times when only smoking cannabis will prevent someone from soiling their pants, from having a seizure. This is proven, this is documented. Medical, not personal. We do need to be aware that without smoking lounges, you're telling people who don't have money that they can't smoke, period. People who don't have money tend to grow their own. It does take money and time to cook. It takes resources, it takes skills. And $27 is a very expensive price when compared to the cost of growing your own medicine and consuming it yourself in a safe location. I agree that it's not fair to expose neighbors to cannabis smoke, and I certainly wouldn't appreciate it myself, but we do need to include a way for people who grow their own medicine to consume it. Thank you.
Thank you. Next speaker is Dicante Moses, followed by Kirsten Vinluam.
Good evening, Vice Mayor and members of City Council. First, I'd like to say thank you for all the work you do for our city and neighborhood. But today I'm here to encourage you to seriously consider the smoke-free multi-unit ordinance. My name is DeConte. I'm a 16-year-old sophomore, and I do go to Vallejo High School. I'm a member of YTAB, and I live in an apartment complex down on Sonoma. Every day, I'm exposed to secondhand smoke drifting from other units. My friends and I study, we play sports, and we're just trying to live our healthiest lifestyle. And the challenges of, secondhand smoke that arise, it's not really helping us live our healthiest lifestyle. I believe the less you are exposed to cannabis and vicious products like nicotine, the less you are less likely to try them. Please help us maintain our healthiest way of life and help us by providing policies that can positively impact our living environment. Other neighborhood cities have done this for their residents, such as Benicia. And again, I'd like to say thank you for listening to us, the youth.
Thank you. Next speaker is Kirsten Vinluam. Apologies if I mispronounced your name.
Good evening, Vice Mayor Verder Aliga and members of the council. My name is Kirsten Vinluan, and I am a 19-year-old Vallejo resident. I've been here for a decade now. I graduated from Vallejo High School, and I've seen a lot of things that are connected to tobacco. For the past 2 years, I've been a part of YTAP, a youth advocacy project for tobacco control. I used to live in an apartment complex. There were 8 units sharing one building and an exposed patio for each resident. I was exposed to secondhand smoke daily, and it was an issue my parents didn't want us to have because they were aware that even brief exposure to secondhand smoke is dangerous and would harm our immune system. Seeing all of this come to a place in terms of an ordinance is something my family and I have been wanting to. I personally acknowledge and thank the council for all the work that's been represented, though I didn't come here to undermine other issues such as medical use of cannabis. I understand the need to use it, but I find it unfair that it's out of the expense of others being exposed to secondhand smoke. As previously mentioned before by other speakers, there are alternatives like edibles or a cannabis inhaler. We can always find a compromise to include others, and is to emphasize the fact that the health is a fundamental right of all. This is something that can be done without weaponizing the ordinance. Eviction shouldn't be part of it. I am here to encourage you to pass the smoke-free multi-unit housing ordinance because every resident reserves the right to breathe clean air and to maintain their health. Thank you and good night.
Thank you. Next speaker is Maricruz Octaviano, followed by Genesis Miguel, followed by Heidi Wohlwend.
I would say good evening, Vice Mayor and members of the council. Thank you for giving us the opportunity to speak. My name is Maricruz Octaviano, and I'm a Vallejo resident for District 2. For the past 3 years, we have been gathering data and interviews with residents about their experiences with secondhand smoke. This is the worrisome issue for me because Solano County has one of the highest rates of asthma, and being exposed to secondhand smoke does not help us. Our air quality is already compromised due to the refineries we have around. I'm a 19-year-old, and I also have a brother who used medical marijuana for his headaches. And when I have a niece who's 4 years old, we had to talk with him about going outside smoking for benefits for my niece while growing up and having a better experience for her and to grow healthy and strong. And it's also sad that Solano County ranks the highest of asthma rates. Kids data shows that 20.3% of Solano County kids suffer from asthma, while in the whole state it is only 14%. Policies like these are necessary to protect the health of our families, even our younger ones, even the ones growing up or elders. So I would really like you guys to please consider the passing of the smoke-free multi-unit housing. Thank you.
Thank you. Next speaker is Genesis Miguel, followed by Heidi Wohlwend.
Good evening, Vice Mayor and members of the council. Thank you for giving us the opportunity to speak. My name is Genesis Miguel, and I'm a Vallejo resident and a senior attending Vallejo High School. I am a youth advocate pushing for youth to succeed in Vallejo. I am here to talk on behalf of the smoke-free multi-unit housing ordinance. For the past 2 years, I've been working in gathering data about secondhand smoking. Multiple people in my family suffer mental health, respiratory health, heart disease, and they usually turn to these dangerous chemicals. Growing up, it's really showed in the way they acted towards me and my siblings. And as a low-income family, I really had to grow up fast. I had to do it early and really take the initiative to really give my siblings, my niece, my nephew, a better future. They have more options than just smoking marijuana and exposing the neighbors to secondhand smoke. When they explore, like compromising with local officials, we can come to a compromise of balance. We can meet in the sweet middle, and instead of just taking one side, we can kind of blend it, and we can create a foundation for the youth to really succeed in a place where they know that they have fresh air. By adding this, we can shift our youth to affordable options. So as people said before, oh, when I looked at the inhalers, it's too expensive for me. In Vallejo, we do have a lot of low-income families, so with the youth, we hope to transform into something more beautiful. But yeah, like I said, I want to encourage you to pass this ordinance. Thank you.
Thank you. Next speaker is Heidi Wolwin, and followed by the last three speakers, Annabelle Salutaria, Kelly Farias, and Ruskell Kiangang.
Good evening, Council. I'm Heidi Wolwind. I'm a Vallejo resident, and I'm here in support of the smoke-free multi-unit housing ordinance, and I really hope that you pass it without any exemptions. People can still use medical marijuana, but they just need to smoke it in a way that doesn't harm everyone in a unit. When you live in an apartment, about 65% of the air is shared air. So that means if one person in your apartment building smokes anything, then you're smoking too. Even your newborn baby, maybe your grandmother that has COPD, maybe your aunt that has just had a stroke or a heart attack. And this air is very toxic. These things are very real. And I think we all know that by example of the wildfires that we've all experienced, where you couldn't even breathe outside because the PM 2.5 was so bad. So it's recently been discovered that bong smoking, for instance, marijuana, is 4 times greater PM 2.5 than healthy air. So it's just like going out in those wildfires and having to breathe that. And you've all felt the heaviness in your chest. I know I did. And I just don't think it's acceptable for something in an apartment building where people are living so close that you have to breathe their air, like the toxic air like that. I think that the medical marijuana is really important, and that we uphold it, and it is someone's medicine, and it's so helpful, but I think that we can't sacrifice an entire apartment building's worth of people for one person's medicine. And so I would just like to advocate that you please pass this ordinance for the health of the city of Vallejo. Thank you.
Thank you. Next speaker is Annabelle Salutaria, followed by Kelly Farias and Ruskell Kiangang. Apologies if I mispronounced your name.
Good evening, Vice Mayor and board members. My name is Belle, and I live in Vallejo with my 75-year-old mother in the condo that I own with mortgage. I'd like to share my experience with you with my smoker neighbors. Living this close to other people forced us to be tolerant, but the issue of secondhand smoke had serious consequences for us. We experienced the most harmful effects of the toxic chemicals from exposure to tobacco and pot smoke during the height of pandemic, when we had neighbors who were chain smokers of tobacco and pot inside their house, outside, in common areas in front of our building, in balconies, in garages. We had our garage under our units, and the smoke would just go up. I had a really bad allergic a real bad allergic reaction to smoke. I had no history of asthma, but I experienced bad headaches. Right now, this is not my normal speaking voice, but for the last 2 years, this has been my voice. I had chest tightness. I had swelling inside my nose that I had surgery because it was persistent. It's as if I had a perennial allergic the whole year round, especially when I got exposed to smoke, especially tobacco and pot smoke. And then also, I had the surgery, they had to pile down my nasal bone inside to increase my airway. And then also my mom she's 75, so she had chronic conditions, but they are well managed. She has diabetes, type 2, and hypertension. But during the pandemic, when we had our neighbors, chain smoker neighbors next to us, she had dizzy spells, and I had to take off from work so I can take her to emergency, I can be with her. And can you imagine if she actually had a fall? At 75, it would be hard for her to recover from a fall, and it would have been downhill from there. So I really would like for you to pass this ordinance, because with a regulation like this, it would ensure an equal application for everybody. Because, we were trying, as a small Asian person, taking care of another elderly, small female. So I had to keep my peace with my neighbors. I just cannot, I avoided trying to get into confrontation. And also, during this time, it was not only my allergic reactions. I could not sleep at all. It's like my mind was stimulated. I was awake in the middle of the night, in the morning, and I was also, and I still am, an essential healthcare worker. I'm a public health nurse with Solano County, and I actually do the surveillance for infectious disease in charge of COVID. So I was one of the most tested employees of the county. And I never tested positive for COVID. So rest assured that my hoarseness, my symptoms were not COVID related. Every 3 weeks I get tested, otherwise they would not let me in the building. And I also was providing guidance to providers in the county.
Thank you.
Right now I'm on...
Your time is up, but thank you so much for sharing.
Thank you. I'm sorry.
Appreciate your feedback. Thank you.
Thank you. The next speaker is Kelly Farias, and the podium moves up and down for people who are various heights. So I should mention that before.
Well, thank you, and I'm sorry that Annabelle didn't have enough time to finish her story, because it's actually Annabelle who brought this ordinance in front. It's a resident. She owns her own condo. She worked really hard to be able to own a place. And now she's faced into somebody that is imposing a lifestyle that she hasn't chosen. So I wanted to say that I am a public health advocate working on issues that affect our community. And tonight I'm here to talk about on behalf of people that have been affected because of secondhand smoke. The U.S. Surgeon General has confirmed that there is no safe level of exposure to secondhand smoke. Smoke is a smoke. It doesn't matter if it's cannabis, tobacco, or sage. Like the chemical reaction of smoke turns into carbon dioxide. And if you are exposed to that, someone had mentioned that 65% of the air that we breathe in our home comes from the outside. So please, I encourage you to think about how to make Vallejo City a safe city for the youth that are here, for kids, for older people, for the vulnerable, for the low-income families that cannot afford to buy a home. We live in the Bay Area where it's almost impossible to own a home. I don't own a home. I rent, and I rent from a duplex. And I am so thankful that my neighbors are very conscious about smoking the medical cannabis far away so they don't affect my kids. I have youth, and I don't want my youth to be exposed to a smoke that it's going to be really easy for them to try it, because once you're exposed to it, it's easier for you to say, oh, well, you know, everybody does it. I should just do it too. So we really need to protect, and we need to look at our other neighbors, our cities that have done this. There are models that we can replicate. We're not reinventing the wheel. We can check and see how they're being successful. Someone had mentioned eviction. There's a lot of models, and I think we were able to send them to you, that the language can be in a way that it's not tied to evictions. We need to be able to protect our citizens. And for that, I thank you for the work you do. You stay late. I've been following you through Zoom, and it's remarkable, the work that you do, and I just want you to take a moment to think about the life of the others. Thank you.
Our last speaker here in person is Ruskell Kianging.
Good evening, Mayor and Council members. As Senator Nancy Skinner would say, deja vu, bill like last year. Since this bill was introduced last month, and there has been no changes for tonight's meeting, and as we've heard from everyone tonight, it needs more amendments, especially concerning the issue of SAGE and also the religious exemptions. So I would not rubber stamp this policy, this bill tonight. It needs more amendments, it needs more work. Let's, as the senator would say, we should not rush legislation. We need to take our time to craft the best legislation. So thank you, and we need to not rush this. We need to take our time on this. We need more amendments to make it the best. And also, what other cities that have this legislation in place, similar to Vallejo, with similar challenges, what is the efficacy and how's that, what's working and not working? That needs to also be factored in and considered. Thank you.
Thank you. That concludes the speakers for in person. Naveed, do we have any virtual speakers? How many do we have?
Yes, Madam Vice Mayor, we have 10 speakers.
Okay. Well, call on number one. We'll give them 3 minutes.
Sure. Tino Ratliff, go ahead, please.
Thank you. Good evening, council members. Thank you for bringing this ordinance for us to discuss today. My name is Tino Ratliff. I am a member of the Tobacco-Free Solano. I am a resident of Vallejo, and my family and I live here in central Vallejo. We love our city, and we care for the health and well-being of all our residents. As stated during the commendations portion of the agenda, Vallejo is all about community. We are a community that looks out for one another. I believe that the smoke-free multi-unit housing is another way that we can look out for each of our residents and neighbors. As stated earlier, up to 65% of air in an apartment can come from other units. Research shows people in apartments near smokers can be exposed to potentially hazardous levels of secondhand smoke for 8 to up to 24 hours a day. I know that secondhand drifting smoke affects all those who are in contact with it, no matter if they're smoking or not smoking. And the effects remain long after the person who has smoked finished due to third-hand smoke on the walls, curtains, furniture, and clothing. This is also a health equity issue. Those who are most impacted by secondhand smoke are low-income folks and people of color. This resonates with me particularly because I am a Black man who grew up in low-income housing. And I know how hard it was for my parents to struggle to take care of us and provide a safe, healthy home, place to live. We need to protect our people. When it comes to medical cannabis or even recreational cannabis, this ordinance does not ban cannabis use. It's just protecting residents and their families from harmful smoke. Cannabis can be consumed in other forms that are healthier than smoking it and do not impact others' health that live with the consumer and in other units. The ordinance isn't stopping folks from consuming cannabis. It's just asking that you do not consume your medication in a way that that impacts the health of others. That seems reasonable to me. 440,000 people die in the US from tobacco-related disease every year. It's the leading cause of preventable death. In 1988, I lost my stepfather to lung cancer caused by his smoking. I was 9 years old and remember that it was very traumatic and it affected our whole family. I ask that you take this into account, and I urge you to strongly pass this ordinance without any.
Sarah Armstrong, go ahead, please.
Good evening. Can you hear me?
Yeah, we can hear you. Go ahead.
My name is Sarah Armstrong. I represent Americans for Safe Access, founded in 2002. We are the nation's oldest, largest national organization for medical cannabis patients. You have several letters from me, and I hope you have had time to review them, as well as a letter from my colleague, Dr. Dale Geringer. We do not support smoking, tobacco smoking. We think it's dangerous. But patients fall into a slightly different category in that their medicine is doctor recommended, and they need to be able to smoke in their homes because it's illegal for them to smoke anywhere in public, and often they need immediate relief. We are not suggesting that patients blow smoke in anybody's face, but we hope that the council will consider this to be a private matter between the landlord and the patient so that they may work together to find alternatives that do not burden their neighbors. Air scrubbers, moving the patient to a location that would allow them not to bother their neighbors, and other options exist, suggesting that patients should not have access to their medicine except for certain types, or that they use untested, unregulated mechanisms ordered off the internet, is not a compassionate solution. As Dr. Geringer has pointed out, cannabis smoke differs materially from tobacco smoke. Both are obnoxious to those who don't like the smell of smoke or who have allergies. But once again, letting this be a private matter between the patient and the landlord is a much more compassionate solution than having someone who is in the throes of stage 4 cancer, suffering economic detriment, or being evicted. We hope that you will consider the plight of the many cannabis patients in your community. You have licensed stores, so they might access their medicine. If you do not allow them to smoke in their homes or consume in their homes, they have no other alternatives. Thank you for your time and attention.
Teresa, go ahead, please.
Hi, good evening. My name is Dr. Teresa Munoz, and I am a women's health care provider. I've been a gynecologist in the East Bay for the last 10 years and have taken care of many patients from Vallejo. I was at your last council meeting when this ordinance was discussed. And at that meeting, I spoke a lot about the health effects of secondhand smoke. And I think you guys understand that there is sufficient evidence to say that secondhand smoke is detrimental to our health. It does not matter where that smoke comes from. We know that, for example, that many women in third world countries develop severe lung disease from inhaling smoke from the combustion of wood and other objects. So smoke in general is bad for our lungs. We also heard a lot about the concerns for patients that require the use of medical marijuana. yet there was little talk about the rights of our children. I don't know if you guys understand that lung development continues throughout childhood. Children are particularly vulnerable to smoke. As you know, we are also experiencing worsening outdoor air quality due to worsening wildfires. This is not something that's going to get better. So it is unfair to continue to expose our children to poor indoor air quality as well as worsening outdoor air quality. This is only going to set them up for chronic disease that will affect the rest of their lives. Finally, I would like to say that while marijuana is an effective medicine, the most effective management for many chronic conditions is a multimodal approach, meaning that in addition to using marijuana, patients should also be using other modes of other treatment modalities, such as behavioral cognitive therapy, physical therapy, and in many chronic conditions, even lifestyle changes can improve pain and other ailments. I like to say also that it is the cannabis industry's responsibility to provide products that are safe not only for their patients, but for those around them. Obviously, the smoke from marijuana is also detrimental to the person who's smoking. And I'll conclude by saying that it is your responsibility as public officials to keep your constituents safe and to safeguard the health, especially of those that are more vulnerable, our children. Thank you very much.
Sam Houston, go ahead, please.
Hi, my name is Sam Houston. I'm a resident of South Vallejo, and I'm commenting to encourage council members to remove cannabis from the smoking prohibition. There are many medical patients that use cannabis to treat their illnesses. There are many legitimate medical situations where someone may need to smoke or inhale their cannabis medicine. Inhalation is one of the ways a patient can absorb their medicine the fastest, and this is key for patients that suffer from ailments like epileptic seizures. I'm concerned that the smoke-free ordinance would constitute a de facto ban on cannabis use for many low-income residents who can't afford their own homes. And overall, honestly, I'm concerned that this smoking ban could be used as a way to target low-income residents and cause needless issues for people. Previous speakers have mentioned inhalers as an option, though cannabis inhalers are not available in Vallejo. Councilmember Brown's dispensary does not carry inhalers, neither does V-Town Farms, Vallejo Holistic Healthcare, or other dispensaries in town. And I also wanted to mention that I agree with Mr. Haldane. I would like to see Vallejo make it safe and legal for residents to consume their medicine. He mentioned the economic efficiency of being able to grow their own medicine. So then if we outlaw their ability to consume it, if we go down this path, I would like Vallejo to consider making it legal for people to consume medicine at places like cannabis consumption lounges, of which Vallejo does not allow at this time. Thank you, everyone, for your time, and I appreciate hearing everyone's stories tonight.
Amaya Wooding, go ahead, please.
Thank you. Hi and good evening, Council. It's Amaya Wooding with the Tobacco-Free Solano Coalition. As one of the previous speakers mentioned, it is well known in LGBTQ communities that some of the most frequent users of cannabis are trans women like myself. For the record, however, I am not friends with that speaker. I don't know you. Hi. I'm also not sympathetic to arguments that there is a right to specifically smoke cannabis. Again, as a trans person, I will be the first to tell you there is no right to force someone else to take your medication, but that's what secondhand smoke becomes when it travels between walls. And we've already heard that 65% shared air statistic, but it's worth repeating. In brief, this is a health equity issue. Low-income people renting multi-unit housing should not be forced to sacrifice their lungs and their health because they can't afford to have their own detached home. As we know, because of the history of this country, renters are disproportionately people of color who are already more likely to be exposed to secondhand smoke while working. Their health should be protected at home. I would also like to point out that there are free cessation programs, or rather free cessation services, available right now from Kick It, California. There are free texting-based programs. There are free apps. So the resources are out there already at no cost. Thanks a bunch and good night.
Rhonda Chadwick, go ahead, please.
Hi, can you hear me?
Yeah, we can hear you. Go ahead.
Hi, I'm going to call my little speech here weaponized ordinances. Medical marijuana, we've worked really hard and we've done really good works. I'm the owner of Homegrown Holistic Collective. I'm a disabled human being, a disabled vet. I need my medical marijuana in order to maintain my body. Don't punish us and criminalize us again. I'm all for no smoking of cigarettes with chemicals. Marijuana doesn't have any chemicals unless you introduce those chemicals in. Edibles, waters, tinctures, inhalers, etc. are made with those chemicals. I cannot consume those. They make me very sick. I can only smoke it. It's a different thing when it goes straight from your lungs up to your brain. And it's different if it goes through your stomach and through your intestines. We've had long conversations on all of this. I'm homebound. Many people are homebound. We need to be able to consume our marijuana. Let me smoke on the back of my property in a tent. I'm good with that. That sounds like a good idea to me. Privilege. We have paid dearly and worked very hard for these privileges to be able to medicate. Protected people like me, we are a protected class of people. I am, and I need this. I have had one company that has come into my Homegrown Holistic Collective within the last 3 years with an inhaler. We gave it free to the patients. They did not like it. Neither did I. It did not do what we needed it to be able to do. I'm going to say that if you are afraid to breathe the air of cannabis, I would suggest that you no longer go outside and breathe the very toxic and polluted air that's outside of all of your homes. All of a sudden, I'm hearing about third-hand smoke. You mean what? On a wall? He said. So are you guys going up and licking the walls or something? I don't mean to be disrespectful. Get the landlords to put in air scrubbers like you did me. I paid $8,000 in a permit each year, $500,000 in taxes each year. I really need to be able to keep this going for all my patients. Many of my patients are homebound elderly. Stop punishing us. We're good people. We're law-abiding. We're sick folk. Please take this off. Don't compare us to cigarettes. We've already had that argument. Maybe if we try hard, we can find a way to get through this. Please don't make me.
Vanita Verma, go ahead, please.
Thank you very much. Good evening, council members and the mayor. And I'm Vanita Verma, and I live in a single family home. My neighbor smokes tobacco as well as marijuana. A family member who is sensitive to smell and gets asthma attacks due to them cannot enjoy outdoors due to that. I can only imagine how it is to live in a multi-housing complex. We have research to prove that the secondhand smoke is truly harmful for growing minds and newborns, as well as unborn babies. By the way, marijuana does contain THC, and it is a chemical. There is no smoking element that you are smoking, and it does not have chemicals. If it was not a chemical thing, you will not be getting help from it. So the previous speaker who spoke about having no chemicals in it, I'm sorry. You might want to check your facts a little bit. We want our next generation to be to live a happy, healthy, long life. If we continue on this path, we are going to create more marijuana smokers than not. When these kids, babies grow up, they will have more health issues than not. My daughter, who has chronic pain, uses oral CBD for her pain relief. I'm proud of her that she chooses a holistic method to manage her pain instead of method that is harmful to the community she lives in. I will respectfully request people who use chronic pain as an excuse to smoke, because that there are alternatives. I don't believe in allopathic medicine myself, but I'm sure you will agree that there are alternatives, and there is no need to put the community in harm's way. I respectfully request the council to consider health of our community and children who are our future. Thank you.
Tracy Nashant, go ahead, please.
Good evening, Mayor and council members. My name is Tracy Nashand. I am the project director for the Tobacco Prevention and Education Program for Solano County Public Health. Earlier today, I had sent a document to City Council from the Public Health Law Center titled Smoke-Free Housing, Marijuana and Multi-Unit Housing in Residential Settings. And it is a Q&A type of fact sheet. And one of the things that I found interesting again is we've heard already tonight, and we already know that cannabis as well as tobacco has many different harmful carcinogenic materials in them, such as acetylidine, arsenic, benzene, chromium, mercury, nickel. And I thought it was interesting in reading through this process that one of the things that I was wondering is secondhand smoke exposure also has an increased risk for passive exposure to marijuana smoke can result in measurable concentrations of THC, the ingredient that produces marijuana psychedelic or psychoactive effect, in non-users' blood, serum, and urine. This made me wonder that what if a resident who may be on parole is exposed to cannabis through the ventilation system and wondering what should happen if their parole officer should happen to do a surprise inspection and say, give me a sample. This person may not be a user, but has been exposed to it. So therefore, this may violate their parole. Made me wonder that. Another piece that is very interesting that people have wondered about is ASHRA, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers, updated the air standards to include cannabis smoke, as well as emissions from electronic smoking devices in its definition of environmental tobacco smoke. The Society's position that the only way to effectively eliminate the health risk posed by indoor exposure to secondhand smoke is to prohibit smoking. Another piece that was interesting that one of the earlier speakers was discussing about the 90-day imposing of this ordinance if should happen to be passed. The 90-day would be my assumption that it would be passed that landlords would then need to enact this into their rental agreements. It would take time, probably up to a year, at least in my assumption, that it would be over a year period of time that landlords would be initiating this into new leases. It gives time for individuals to seek out those cessation programs and to seek other alternatives, such as for the marijuana consumption. Thank you for your time. Have a good evening.
Tony Bowles, go ahead, please.
Yes, could you hear me?
Yes, we can hear you. Go ahead.
Yes, hello. I am Tony Bowles, the chair of the Bay Area chapter of Americans for Safe Access, the largest national member-based, patient-based organization promoting safe and legal access to cannabis. So we are asking for the removal of the prohibition of cannabis consumption by patients in their private homes from the ordinance. Per state law, cannabis cannot be consumed anywhere else in public. If you ban cannabis use in the home, patients lose all access to their medicine. I am at least demanding a 6-week extension to come up with consensus. Studies show cannabis does not cause cancer. It in fact prevents cancer. San Francisco, San Jose, and many other cities have already exempted cannabis in their non-smoking ordinances. In the name of safe access to medical cannabis, we are asking for this exemption. Smoke-free ordinances, I agree with when it comes to tobacco, but when it comes to cannabis, we should look into this more. Cannabis is medicine. Cannabis has been declared essential by the state. So please do not ban patients' consumption of cannabis in their homes. It is essential. Thank you.
Phone number ending in 559. Go ahead, please.
Sure. Thank you. Good evening, council members. I'm Liz Williams with Americans for Non-Smokers' Rights. Thank you for considering expanding the city's smoke-free protections to include multi-unit housing. We strongly support the law applying to all types of smoking and vaping. This is because, as you heard, all types of smoke from all sources, including marijuana and tobacco, contain that fine particulate matter that gets breathed deeply into the lungs and creates numerous health risks. And residents, as you've been hearing, are talking about how they are suffering from breathing their neighbors' tobacco and marijuana smoke and how little ability they have to improve that situation. Most people just can't up and move. Vallejo residents in apartments and condos, especially lower-income residents, should be able to breathe smoke-free at home, just like people who live in freestanding houses already can do. We would not support a marijuana exemption because that would continue to expose residents to their neighbors' drifting smoke. People can still use tobacco and marijuana, as others have pointed out, including medical marijuana. This is simply about not smoking it or vaping it inside apartments and condos because it shouldn't be used in ways that harm other people. And Vallejo would be in really good company by adopting a strong law that requires all multi-unit housing to be smoke-free. You would join dozens of other California communities that already provide these smoke-free protections to multi-unit residents, and the vast majority of these laws do not have an exemption for marijuana. And just to clarify the last point, San Francisco and San Jose have not adopted smoke-free multi-unit housing laws. They did have exemptions for marijuana that were proposed, but those proposals were pulled to be reconsidered because of the opposition from people who are worried that a marijuana exemption would create health risks for neighbors. So thank you for your leadership and for considering this issue.
Madam Vice Mayor, this concludes all the speakers.
Thank you. Thank you for all your comments. I'm going to ask council to make comments, ask questions, and make comments, and we'll proceed. We'll take it from there. Who wants to speak first? Councilmember Arreola.
Thank you, Vice Mayor. So a lot of compelling stories tonight, and it's clearly a divided issue. There's passion on both sides. I really like the speaker, who's somewhat a live speaker, that spoke eloquently about balancing, and that really struck me because here was a person on the anti-smoking side, but thought perhaps we could come to some sort of balancing act where it benefits both sides. And I'm not sure what that balancing act would entail, but clearly smoke comes in many forms. And if smoke is indeed the main factor, it is the pinnacle of what this conflict is about. Early on, the first two times, I thought it strictly was about tobacco. That was an easy thing for me to decide. No, we don't want that in houses. But now I'm hearing all of the other factors that are involved, particulates and all kinds of chemicals and clinical and medical terms. The smoke comes in many forms. There's a smoking form with cigarettes or cannabis, even chemicals you can smoke. But then there's burning. You can burn incense. How about cooking? And someone burnt a pot of rice on the stove. That smoke is really bad. Fireplaces or outdoor fire pits, for that matter. That's smoke as well. And then I'd like to know how this ordinance will be enforced. What is the plan after that? Because pitting neighbors against neighbors could really result in an anti-smoking rage, evictions, and fines. So I see this as a flawed ordinance. It needs a do-over. As some of the commenters mentioned, take this paragraph out or that wording out, but don't take out the medicine that people need for their care. That's what I ask. Thank you.
Thank you. Councilmember Luera Diaz.
Yes, good evening, everyone. I'd like to thank everyone that spoke today, especially the youth. I think that it's important that you participate and start young, because there's a long way ahead of you to be able to make your voices heard. I'm a huge advocate of children's rights. I'm a grandmother and I'm a mother, and for most of my adult life, I've dedicated as a prior social worker to working with families and making sure that the children are safe, not just with secondhand smoke, but in every way. You know, when we say we want our rights respected, we need to be conscious of everyone's rights, especially those that are most vulnerable and that don't have a voice. It was mentioned tonight that smoking ordinance would cause homelessness. Well, you know, protecting children's health and moving from an apartment that you barely were able to afford also causes homelessness. And it's not just homeless of one person, it's homeless of families, children, elderly. It was also mentioned that there's alternatives available for cannabis users. There was a couple of things that were mentioned: patches, edibles, cannabis, inhaler. Children don't have those alternatives. Pregnant mothers don't have those alternatives. Elderly, bedridden people don't have those alternatives. We have several activists in town that are very, very vocal, that advocate for fresh air for all. This is the same thing. This is advocating for fresh air for everyone. You know, our city has some of the highest asthma rates in the state. Our children, especially those children that have been mentioned here, people of color like me. I'm Mexican, I'm brown, African American, Native Americans, low-income people. You know, those are folks that have the highest asthma rate, and those are the folks that we need to protect. Not just them, everyone, but I'm mentioning them because it's been mentioned time after time that people of color are affected, that will be affected by being put out of their homes. Well, they're also being affected by having no right for their children to be able to breathe and grow and flourish and contribute and be productive citizens as adults. We need a robust community engagement to inform and engage and find ways to improve the information being distributed to our residents. This isn't something that we just want to put out there. There's outreach that needs to be done so that people are informed of what's going to happen, how it will take place, and how it will be enforced, as my colleague, Councilmember Ariola, mentioned. I want to state this very, very clearly. This ordinance is not intended to evict residents. It's intended to protect residents. I want to reinforce the need for additional code enforcement staffing, since they will have additional responsibilities. We need to have more staff if we're going to move this forward. And lastly, I want to mention that we are not just a city coming up with an idea out of the blue. There are 74 municipalities with laws of 100% smoke-free multi-unit housing. Among them, in our area in Northern California, there's Alameda, Benicia, Berkeley, Clayton, Concord, Contra Costa County, El Cerrito, Emeryville, Novato, Petaluma, Richmond, that has a diverse population very, very similar to Vallejo. San Rafael, Sebastopol, Sonoma County, Union City, and Walnut Creek. Some of the others are down in Southern California, but I'm using these as examples. These are municipalities, cities, and counties that are around us that are already doing this. We're not reinventing the wheel. This is already being done. 19 municipalities have partial restrictions for smoking in multi-unit housing, and some of those around us would be Fremont, Dublin, Oakley, and Pinole. So I support this ordinance. I support it as it is. I stand with the rights of children. For too long, our city, our state, our country has neglected to enforce the rights of our kids. And if you stop for a minute and see how our kids are growing up, in the households that they're growing up, without having a voice, without standing a chance, we owe it, not just morally, but we also owe it to them in every way possible to do everything that we can to help them grow up and stand a chance. Thank you.
Any more comments? Councilmember Meisner.
Thank you, Mayor, or Vice Mayor. I just promoted you. So this is definitely a very challenging, I think we all agree that cigarette smoke and exposure to cigarette smokes, it's not good, and we want to get rid of it in multi-unit housing. But it's, of course, the cannabis smoke, because it is medicine for some people. And so it's, there's either way that we vote, somebody is going to be very disappointed and have their rights continue to be curtailed or their rights curtailed. Well, first of all, so my mother was a lifelong smoker, and she died of COPD caused by her cigarette smoking. She was addicted; she could never quit. But one of the things that helped her slow down the smoking was all of the restrictions on cigarette smoking that happened when she was forced to go outside, and she lived in Massachusetts, so it was cold. She had to go outside to smoke. She was very pragmatic, and she drove a lot for her job, and she realized that when she was trading in her car, having it covered with this tobacco smoke was really, it destroyed the value, the trade-in value. So she stopped smoking in her car. And if you've ever driven in Boston, Massachusetts, you will know that it'll make you smoke if you don't smoke. And she, my dear mother, it was just Mother's Day, and so I just have she was very clever. So when she was getting more and more ill from cigarette smoking, she was getting blood thinner shots, and the visiting nurse would come to the house. And she stopped smoking in her house because she didn't want the nurse to know she was still smoking. So she went out on the porch and smoked. And, then my mother could do it, I'm sorry. But I think as Councilmember Laura Diaz very eloquently talked about the rights of children and the rights of people who are exposed to smoke. So I was growing up living in cold climate, and the windows rolled up, we're driving to church, and the car's full of smoke, and it made me sick every morning. In honor of my mom, I'm supporting this as is, and I want to thank staff for working on it, and I want to actually, again, want to thank the youth that have come out and spoke. You guys are awesome, and keep up the great work. Thank you.
Councilmember Du?
Thank you, Vice Mayor. I echo my colleagues' comments, and I also want to say to our young adults that showed up tonight to speak how proud I am of you, what great ambassadors you are for our community. Thank you for standing up and speaking to us tonight. I have similar stories. My mom was a chain smoker also, and growing up with that was a challenge. I actually became a smoker myself when I was very young, and it was incredibly hard to quit. And it was incredibly hard for her to quit, but she was able. She almost died, and that's how she was able to finally get the motivation to do it. But I know that. People can quit. They can find ways to smoke somewhere else. For the cannabis, I would be open to allowing lounges at the dispensaries. I don't know if that would be a conversation at another time, as long as there was signage for, designated drivers and all of the kinds of things that we do for bars. I think that would be appropriate. But otherwise, I would support what's written tonight. Thank you.
Thank you. Question for City Attorney. I know I have a discussion with you about the allowing lounges, smoking lounges in dispensaries. Is that something that we will be taking up in the future?
So there's two pieces to that particular puzzle. State law does permit, under the cannabis regulations in state law, that a municipality can make a determination to approve smokers' lounges in retail establishments. Okay. They must comply with certain restrictions about who can go in and out of them and where they have to be located, and it has to be a separately enclosed area. But again, they are permitted, or you are permitted by state law to allow them. Okay. With that, I would say that there would need to be what I will call a fairly minor change to this ordinance, the smoking ordinance, which I can give you if the council is interested in doing that. And then we would need to go back and look at our retail cannabis ordinance and see what changes would also need to occur there to allow them to be permitted and inspect the separate room, et cetera. So the answer to your question is yes, it absolutely can be done. And it would be akin to something that is already permitted in this smoking ordinance, which would be a smoker's lounge and a retail tobacco shop. Again, meeting the same requirements. So we can make that amendment to this ordinance and then make the concomitant amendment to our retail cannabis ordinance.
Okay, so we can make that slight change, but you know, I'm going to support my 3 colleagues here that I want this to be approved without exemption. But adding on that amendment, is that?
Yeah, you could add on that amendment, and
Okay.
I have actually, given the discussion tonight, pre-written that amendment into my copy of the ordinance, which I can read into the record for introduction if the council is interested in
Okay,
doing
I just
that.
want to make a short comment. Again, thank you to all the folks, especially the young people. You know, that this ordinance was initially conceived or thought of or presented to us, Councilmember Dew, Councilmember Malgapo, 4 years ago by Fighting Back Partnership. Dante De La Serna was the health advocate working for Fighting Back, but it was not the right time to pass it. There was not that traction. But last year, you folks, I'm so very impressed with your advocacy, your courage. Like they said, it's not popular, but it's what courage that drives this city and what drives this nation. It's we have to be courageous to fight for the right thing. And in this case, it's a slam dunk for me. I did not flinch when this came to to the council, and approved by a majority of this council will be agendized. And now we vote on it tonight. And like I said, I also have a dad who smoked until he was like age 65, and he quit smoking because he knew he wanted to live longer. And thank God he lived up to age 94. And so, smoking cessation, there are smoking cessation classes in the county, and so please take advantage of that, because quitting smoking now will help. You want to live longer, you have better chances of living longer if you quit smoking and practice a healthy lifestyle. So children are most vulnerable. That was already mentioned by my colleagues here. I have adult kids, but I know a lot of young kids. Once they were little kids, and babies, most especially, are very vulnerable. And adults, Ms. Salvatierra, thank you for speaking up. Did I get your name correctly? Salvatierra, right? And thank you for being here. I don't hear from you, from the Filipino community that often, so I'm very thankful that you share this passion and this advocacy, so thank you. To the young people, I know Genesis Miguel, thank you for being here. And so for this, it's a moral duty for me to support this ordinance without the exemption. And I'm going to defer to, go ahead. Councilmember Luera Diaz.
Yes, I'd just like to add that I want to thank Rhonda Renfro, Dr. Rhonda
That's right,
Renfro, with Club Stride. She has done a tremendous amount of work with our youth in many aspects, and this is one more thing that she also brought forward. So I want to thank her and make sure that people know that she did a lot of work on this. Thank you, Rhonda.
Yes, thank you. Dr. Rhonda Renfro, I know you're watching. Joseph Hayden, thank you for bringing this forward and, really keeping us on task and just being here. Thank you so much. So I'll entertain a motion. Councilmember Meester? Oh, wait.
Just
City Attorney,
couple
go
of
ahead.
points. Absolutely. Thank you. I just wanted to point out that most of the state regulations that are addressed to cannabis are contained, many of them are contained within the Business and Professions Code in the Section 26,000 and following. A couple of the provisions relating to that are important to the council this evening, I believe. In Section 26200, the state makes clear that local jurisdictions can impose regulations relating to reducing exposure to secondhand smoke. Subsection G of that same section is the section that allows us to adopt regulations allowing retail establishments to have a smoking room of their own. I also want to point out that the section of the code that allows for cannabis consumption to be legal in the state actually already provides that cannabis consumption is not determined to be legal in any place where smoking tobacco is prohibited. So I think for our ordinance, we called out cannabis as a way of making it very transparent and clear to the public. But under state law, you cannot smoke cannabis anywhere. You cannot smoke tobacco as it is.
Good, okay. So are we clear? Is the amendment clear? Okay.
The amendment,
Go ahead.
thank you. So if you will turn to page 195, read 195 of your packets, and I guess that doesn't help if you don't have it printed. It is in the definitions section of the ordinance. So that section is 7.68020. And it is the definition Q that is in play here, which is the definition of a private smoker's lounge. Right now it reads, means any enclosed area in or attached to a retail tobacco shop. So the proposed change would be to add or licensed retail cannabis business complying with section 26200 of the Business and Professions Code. That is, and then adding the words lawfully established and dedicated to the use of tobacco products or cannabis, including but not limited to cigars and pipes. So in that way, we would open the door to, doesn't mean it would still have to be licensed as part of our other ordinance, but that opens the door in this ordinance without the need to come back an amendment to allow it where we've otherwise licensed I'll call it smoking room in those establishments.
Good. Okay, thank you. There was also a question on enforcement, and then once we vote on it tonight, it takes effect 90 days. So you're going to put out a second reading?
So two things that to bear in mind. We already had a smoking ordinance within the city. It just didn't address the multi-unit.
Multi-dwelling, yeah.
Right. So the 90-day delay in its effective date is second reading, then 30 days, then another 90 days after the effective date of the ordinance. So it's a little longer than just 90 days from today. Relates to the multi-unit component of the ordinance. It doesn't relate to places of employment, et cetera, that were already tobacco prohibited under our existing ordinance. Enforcement, sorry.
And then notification to multi-dwelling unit owners. How is that going to be implemented?
So this ordinance is somewhat unique in that its intent is to allow multiple different methods for enforcement, if you will. So yes, there can be citation authority and enforcement by code enforcement of any adopted regulation that is violated. This ordinance also declares smoking in an area where it is prohibited to be a nuisance. A nuisance can be enforced as a public nuisance or as a private nuisance by your neighbor. So for instance, if there is no citation authority and your landlord does not perform accordingly to enforce a non-smoking ordinance, then you have the right under this ordinance to enforce it yourself as a affected person. Then obviously there is the landlord. It is implied, the ordinance has it implied in leases and requires landlords to, within the 90-day period, put it into all new leases. So in that way, there are landlord enforcement, private enforcement, code enforcement. So there are three ways for the ordinance to be enforced.
Okay, good. Thank you. I think if there's no other questions, I'm going to entertain a motion. Councilmember Meester.
Thank you. I'd like to offer that we introduce and amend the introduce an ordinance to amend Chapter 7.68 of the Vallejo Municipal Code, regulation of smoking in public places and workplaces to prohibit smoking in and around multi-unit residences and other publicly accessible places, and to update outdated provisions of the chapter to conform with state law, and to include the amended language as suggested by our city attorney.
Thank you. Please vote.
Motion carries with Councilmember Ariel opposed and Mayor McConnell and Councilmember Brown abstaining due to conflict of interest.
Thank you. Motion passes. Congratulations. We are going to take a 10-minute break. Thank you so much.